Hi everyone, today I'm here with my friend Dr. Naba Sharif, who is an allergist immunologist, and I had some questions that I have on my phone that I'm going to ask her. So Naba, what is the deal with horrible allergies this season? Everyone seems to be complaining about it.
That's a great question, Rehana, because it's absolutely true. People are suffering a lot more this season than in years past. And the reason is because, as you know, we kind of got through a really horrible winter season. It was really long and really cold, and people were calling it a polar vortex.
Yeah.
And currently we're in the middle of what a lot of people are actually calling a pollen vortex. So there's a lot more pollen in the air than there's been before. And the reason for that is because trees were dormant for a lot longer. And generally, trees pollinate at different times, depending on the type of tree. Mm-hmm. But now, because of the delayed winter, the trees are actually all pollinating at the same time. So there's a lot more pollen in the air. And then adding on to that, the grass pollen season, which actually starts in the summer, is actually happening at the same time. And so the trees are pollinating, the grass is going to pollinate pretty soon too, so there's a lot more pollen in the air, making people potentially a lot more miserable than they have been in the past.
That stinks. So Naba, I don't have allergies, and I'm always curious as to how some people develop allergies. Can you share some insight on why some people have allergies and why some people don't?
Yeah, sure. That's a good question. So I actually don't have allergies either, so we're both really lucky. But normally our immune system actually makes antibodies to fight off germs. So these are things like bacteria or viruses. But in people who have allergies, our immune system actually makes antibodies to things that are generally harmless, like pollen or pets or dust.
Dogs can attack them.
Yeah. So when someone who's allergic is exposed to the thing that they're allergic to, basically those allergic antibodies set off a cascade of mediators. The most common one that you hear about is histamine, that actually cause allergy symptoms.
Oh, interesting. So why do some people have allergies and some don't?
So that's actually the million-dollar question. I wish I knew the answer. We definitely do know some things. For example, we know that allergies definitely have a genetic component to them. For example, if your parents have allergies, you're much more likely to have allergies yourself. And the statistics are that if one of your parents has allergies, then you're 50% more likely to have allergies yourself. And if both of your parents have allergies, that number actually skyrockets to about 75 to 80%.
Would you have the same allergies that your parents have?
Not necessarily, but it just makes you more predisposed to having allergies in general, or some type of allergy. But the thing is that even with that, allergies, or the prevalence of allergies is skyrocketing. And the genetic component of it is not enough. There's more to it than basically genetics, as far as we can tell.
Yeah, because it seems that there are more kids, for example, that have more peanut allergies or nut allergies, and you know, their parents might not have that. So why are kids getting more allergies? It seems like.
So right. So we do know there's the genetic component, but then basically there's a bunch of hypotheses or different theories to account for why the prevalence of allergies is rising, particularly in the West. And one of the most famous hypotheses or theories is actually called the hygiene hypothesis. So that's basic. I don't know if you've heard of it already, but basically the hygiene hypothesis postulates that because of the fact that when we're kids, that's basically when our immune system is learning how to fight off germs. And so when we're young, you know, we're exposed to a lot of things, so our immune system learns how to do that. But in the West, we're tending to be more hygienic. So we try to be more clean, we promote clean practices, like we have a lot of antibacterial soaps, and in general, you know, you don't see kids kind of rolling around in the mud or in the dirt anymore. And so our immune systems are kind of twiddling their thumbs, kind of looking for something to do. And they kind of start attacking things that normally would be harmless in your system. So that's basically that theory. And the support for that theory comes from the fact that, of course, there are more allergies that are developing in the West. Kids who have less siblings actually develop more allergies, and that's basically postulating that it's because of the fact that there's less exposure. You know, because you go into schools and daycare and you get exposed to things.
And that's probably why parents sometimes are like, you know, let the kids eat the food off the floor. Like, they'll develop some, you know, immunity to to it.
Right, so that's based on the hygiene hypothesis.
Oh, that's interesting. What are the most common symptoms of allergies?
So you've probably seen like the miserable, the person who's miserable with allergies outside, especially during the season. So the common symptoms tend to be, runny nose, lots of sneezing, stuffy nose, maybe itchy, watery eyes, puffy eyelids, coughing, pressure in your sinuses, headaches, things like that generally.
Yikes. And what is the best treatment? What is the best treatment for the most common symptoms?
So if you just want immediate relief, antihistamines are definitely your best bet. And that's based on the fact that histamine is a pretty potent mediator of the allergic reaction. So those are a good starting point, and a lot of them are over the counter. Those are like your Claritin, your Zyrtec, your Benadryl, your Allegra. Claritin and Allegra generally tend to be very non-sedating, and Zyrtec for the most part is non-sedating too. And then the actual mainstay of treatment for allergic rhinitis, which is what we call these symptoms, are nasal steroid sprays. For the most part, you can only get those from an allergist because they should be monitored and you should be explained how to use them. And then there's newer medications like nasal antihistamines, and I tell my patients that's kind of like squirting a Benadryl up your nose, but don't try that at home.
Are those over the counter as well?
No, those are actually only prescription as well. And then the other since you mentioned over the counter, there's other things you can do over the counter, like if you've ever heard of the neti pot or a saline rinse, there's a lot of mucus buildup that happens in your nose with allergic rhinitis.
I don't know if this helps, but didn't someone get meningitis, bacterial meningitis from using a neti pot?
So you can get
Sorry.
you can get fungal infections from not using the neti pot appropriately. So the water that you use shouldn't really be tap water because that's that can potentially be a nidus for infection too. So when you actually use a neti pot, you want to use either distilled water or boiled water that's been kind of cooled off a little bit.
Okay.
But basically that serves to kind of clear out the mucus from your nose, and that's a good over-the-counter thing to start out with too.
So Naba, I've heard that some people can get allergy shots, and it seems to me like it would make sense to kind of just get one shot to deal with it all and not have to deal with allergies for the season. How do those actually work?
So that's also a great question, because a lot of people ask me the question, Dr. Sharif, can I ever cure my allergies, or will my allergies ever go away? Is there anything I can do to get rid of them for the rest of my life? And I would definitely say that allergy shots are your best bet to possibly doing that, because the way they actually work is by building tolerance in your body to the thing that you're allergic to, and basically getting to the point where your body doesn't see the allergen as something foreign that they actually have to respond to. The way that we do this is we actually purify proteins of things that you're allergic to, and we give you small doses of that allergen so your body can get used to it over a long period of time.
So it's like the flu shot, but for allergies.
Well, so it's important that we actually make the distinction because of the fact that people think that it might just be one shot and then you get rid of it, but it's actually a pretty long process that takes a lot of commitment. You actually have to get regular shots over a period of, the current recommendation is actually 3 to 5 years.
Oh, wow.
So it's a commitment, but the long-term payoffs are extremely beneficial, especially if you're suffering pretty bad. But it's something that only allergists can provide. So, but it's an amazing option. And then the cool thing actually is just this year the FDA approved tablets that work in the same way. It's just recently been approved actually
for most allergy proteins, or just specific ones right now?
Just specific ones.
Okay.
So right now the ones that came out are for grass and ragweed, and actually you have to take them a certain amount of time before the season starts. So it's a little late for the grass season now, but for the ragweed season, it's definitely an option. And you have to take them every single day for a long period of time as well. But it's an option for people that just can't do shots, and the ragweed is the worst season for them.
So if someone gets the allergy shots, is it kind of like even though it takes 3 to 5 years, is it kind of like, now I'm going to be done, I'm going to be free of allergies, or is there any maintenance, or will the allergies come back in maybe 10 years, depending on hormones or whatever else is going on?
So that's a really good question, impressive question actually. So, and The reason is because every patient is actually different. There are some people who, develop tolerance very quickly, and that tolerance is maintained over a long period of time, maybe even their lifetime. But then there's some people who, their body takes a long time to develop tolerance, and so their symptoms are not completely gone, but they're just mitigated a little bit. They're just a little bit better than what they would have been if they hadn't gotten shots. So we kind of play it by ear. That's why there's the 3 to 5 year allowance to see, like, if someone is doing great after 3 years, they have 0 symptoms, we do a trial of, shots and a trial of medications, and they're just good to go. We just see how it goes. But then for some people, we do the maximum of, not the maximum, but the upper limit of 5 years. And then there's some people that actually need allergy shots for their entire life. But that's definitely a minority of people. It's not common to need, to need it for that long. Usually the 5 years will last a significant amount of time, if not your whole life.
Oh, okay, great. And I have one last question. So, Naba, I don't have allergies, but if I did and I was going to the drugstore, how should I interpret the different medicines that are available over the counter?
So definitely, like I said, the antihistamines are your best bet in terms of a starting point. There's a lot of herbal kind of concoctions that you can find too, and I can't necessarily say that they don't work. It's just that the studies have been very limited on them, and so you can always do a trial and error type thing. The problem is that especially in this season and in general, when people are suffering from allergies, they really want proven things, and they want really pretty quickly. And so we know from the allergy research things that are going to work, and you kind of have to do a little bit of tweaking to figure out what regimen is going to work per person. But generally, we know that oral antihistamines are going to work. The neti pot, the irrigation is definitely going to work, and then the prescription medications that I mentioned. And then the other stuff, it's just going to have to be a little bit of trial and error and asking your doctor if they know about, or if they have experience with those medications. But
Naba, I think that's all the questions that I had. Do you have any last advice to give to people who suffer with allergies?
Absolutely, Rehana, thanks. So, we've talked a lot about medications, allergy shots, but one thing that I wanted to emphasize is that, any allergist will really tell you that the #1 way to limit symptoms of allergies is to limit your exposure to the thing that you're allergic to. And in this, in this season, it's really the pollen. And so measures you can take to, limit your exposure are plenty, starting with just closing your windows, both at home and in your car, because pollen is airborne and it's very sticky. So you want to prevent it from getting on your skin, on your clothes, and closing the windows is definitely important, and instead just using the AC. Also, in terms of your clothes, pollen can stick to your clothes very easily. So after being outside for a long day, when you come home, you want to change out your clothes right away so that pollen that's stuck to your clothes doesn't stay on right away. Yeah. And then also, you get tempted in this really nice weather to, instead of putting your clothes in the dryer, to hang them out to dry. And for people that are allergic, that's really bad because it gets stuck on your clothes.
Do any of you guys hang your clothes out to dry?
Some people do it, so don't do that. And then also, when you get home, you want to take a shower to get all of that pollen off of you. Instead of taking a shower in the morning when you're fresh, you want to do it after all that pollen is clung to you. You want to get it all off by taking a shower when you get home, or at least before you go to bed, so that you're not sleeping with all that pollen on you. Okay. The other thing you can do is check the pollen counts. So there's websites that tell you the pollen count for your local area, and if you know that the pollen count is really high on a particular day, then try to limit going outside on that day if possible, or at least be much more careful about doing these things, or even taking preventative medications on those particular days. And then especially on those days, but in general also, pollen tends to be more in higher numbers during the morning hours, between the hours of 5 a.m. to 10 a.m. So aside from maybe just getting in your car and going to work, trying to limit your outdoor exposure during those hours is helpful. A lot of people, especially during this time of year, have to, like gardening, and they mow their lawns. Yeah, your blog is awesome for that too. So if you are in that situation where you have to mow the lawn or you feel compelled, to garden, then wearing a mask is actually really beneficial too, just to, again, limit that exposure to the pollen on your face. And then lastly, just pretty common sense things, but that are really important are just having a healthy diet and getting a good night's rest. And because the thing is that, allergies can make you really tired, they can really wipe you out. And so you really want to get yourself in the best shape so that these things don't affect your life as much as they otherwise could.
Allergies sound really painful, but I'm happy that there are doctors like Dr. Naba to help people that have allergies. So I really hope that you guys found this helpful, and Naba will be back with food allergies, since I know that a lot of people have food allergies, and especially a lot of my friends and even my nephew has a bunch of food allergies. So I have some questions for her. If you guys have any questions for her, leave them below, and I will include Naba's information if you would like to see her for an allergy appointment.
Yeah. Cool. Thank you so much, Rehana. This was such an honor, and it was so fun, and I'm totally honored to be part of this awesome vlog.
Yay, great. Thanks, guys. Bye.